Patients come to Kingsway Dermatology for acne scarring treatments because they know they can trust us. The top concerns are dyspigmentation, ivory atrophic scars, brown hyperpigmentation, residual redness. There can be textural changes that are rolling and pinned down, cystic acne that is left full deficits, say in the cheek or the chin. Because we are full board certified dermatologists, we know how to read the skin and therefore we'll know what treatments, or even better yet, combination treatments are right for you. We often stack these treatments together in the same treatment zone. We have laser, a couple of different lasers for redness, dyschromia, texture changes, and deep rolling scars. Subcision and filler is used for those rolling scars as well and gives a nice overall contour to the skin. Occasionally, we also recommend TCA Cross. It's a very aggressive deep peel just for those pitted or very jagged scars in the skin as well. We often recommend a full deep back peel for those clients with acne scarring on their backs. For hypertrophic and keloid scars, we also do cortisone injections, and patients are extremely happy. If you have acne scarring concerns, give us a call. My expert team is going to help you put together a plan of action that's right for you.